Can I start, brother?
Yes. Yeah.
Ah,
Once again, thank you everyone and good morning. And yeah, now Sister Aravati Bose sharing her testimony, how she got benefited from this, supplements and guidance. Yeah, over to you, Sister, please.
yeah. Thank you, brother. So my name is Revati Bose, and I'm basically from Tamil Nadu, but we have settled here in Hyderabad. So during the time of the second wave of COVID, yeah, much before that also, before that, the last 10 years itself, from the time of my giving birth to children, I was having this. Mine was a cesarean session, so because I felt only after that only this kind of a breathing issue started, very much badly after that. So, and once in a while this breathing issue come, and this allergy condition used to come when the climate changes. And as years went by, after my second kid also, the conditions started aggravating, every year, little by little. But every year, by the grace of God, I used to overcome through prayer, and sometimes, yes, I do go to hospital for that. And now and then that nebulization, I used to take. And during the second wave of COVID, we need to really share this. That was the time when some of the people in our church were severely affected, and and especially one person, one brother, he had this 70% lung damage, and he was admitted in the hospital. And he was just in his 30s, and uh, we really didn't know what to do. Only could look upon God, on his promises over our lives. But at the same time, even though we tried this remdesivir and plasma, nothing actually worked. Left and right people were dying, where we put him in the ICU in one of the hospitals. After much difficulty, we got the bed, and left and right young people are dying every day in front of him and going. And day by day his condition is deteriorating very badly. At the same time, some others also in our church, we had this issue, and we also, my husband also was affected with COVID. But however, for us, it wasn't severe. And a few months before that COVID, also, this breathing issue aggravated so much for about 6 months or so. It is like continuously every day I was having terrible breathing issue. And I did not go to the hospital. I was just using this Levolin, Duolin, Budocart, all those nebulizations for me, now and then, and then, just every day I used to just pass the time. But after, during the time of a month before the second wave of COVID, what has happened was, suddenly one day, as I was talking to my husband at home, suddenly there was a complete, literally a complete blockage in my chest, and that is when we were literally very much concerned, and then went to a pulmonologist, and they put me on steroids. And I'm a person who always have a question like, should I go for it? Should I take this path of medications? Because when I heard that it is a lifelong medication that I have to take, and the doctor did not tell me any side effects of the steroids or whatever, I was not even informed this was a steroid. It was generally given to me. And then one statement the doctor said that without asking me, you're never allowed to stop this medicine. I said, okay, fine. I used it for a month or so, and then I kind of researched all by myself, and I found out it was a steroid, and I was really concerned because I didn't want it to take. I knew what are the side effects of continuous using of steroids, which will, which will increase the sugar levels in the body, weight gain, so or hormonal imbalances, so many issues that would come. So I used to have that concern. And then I was praying. I didn't know what to do. So I thought, okay, let me at least try Siddha. And then I kind of tried that one also, but it was way too costly. I'm not against any medications, but then I just tried all those things. And I was not getting any relief, though that medication, the Siddha medications were so different. And at that moment, the second wave of COVID hit the church, and people were admitted in the hospital. And that is when we came to know regarding Dr. Banu, and it is a miracle that we came to know him. It's just God's intervention in our life. And then when we came to know him immediately, that very night, my husband, as a pastor, he decided to, somehow in our hearts and our spirits, we knew this is what God wanted us to do. And immediately we took a call. And Dr. Banu, that entire night, I still believe it was midnight for us, even at 1 o'clock here. And no, it was around midnight for Dr. Banu there. And he was sitting with us, taking all the church people, 5, 6 people in the call. We brought them, and then he was instructing each and every one regarding D3. And that gave a lot of hope. And immediately to the brother who was in the hospital, we began to administer D3 without informing anyone. And and the nearby doctors, because people, and that I clearly know, even when he got discharged, the ICU doctor was saying that it is a miracle that you are survived, because we never had even 10% hope you will come out of this hospital. Maybe the prayers of your church, really protected you. I mean, that was a clear statement given by the doctor, because completely zero hope. And we began to administer D3 to him, high doses of D3, and within a day or two, uh, he started recovering and he was out of ICU. And then the process was little long for him, because it was a 70% lung damage. For the next 2 months or so, 2 to 3 months, Dr. Priyanka was guiding him personally with the doses of D3, and that's how he got. And similarly, for all our church members, we began to give D3 that time. And in that time, what happened was I began to start taking high doses of D3 as per the instruction of Dr. Banu. And I immediately, quit the steroid and started this breathing exercises. Whenever I feel that thing, I used to go outside, stand near the plants, do the breathing exercises as often as I could, and then have that high doses of D3. And by the grace of God, I should really say, within that 1 month, everything was clear in my life. And it's been almost more than 4 years. I am perfectly all right, normal. And my breathing issue was in such a way that as I'm talking to you now, this much level or this much strength when I put to talk, I start gasping for breath. I can't climb the stairs. As a leader in the church, as a pastor's wife, I had to minister in the church, and I could not, but yet I did. So all these things, and then within 15-20 days, I saw tremendous difference. And that 1 month itself, I was perfectly healed, perfectly fine, and completely out of steroids. And it's more than 4 years. And I still remember a couple of years back, for something, some ear infection, I went to an ENT doctor to get it checked. So at that time, when I was telling, and that time, the doctor was giving me a steroid, saying that, ma'am, unless you take this ear infection will not go. And then I shared my experience with D3. He was so shocked to say that, uh, really, ma'am, are you out of steroids? Is it possible? Are you out of steroids? I said, yes, I am out of it for more than now so many years. No, ma'am, it's not possible at all. This is the only medication that is there. And for your breathing issue, steroids is the one that we give. And I refused to take the steroids even for the ear infection. But so he was forcing me, because there is no other way. After giving 2 weeks of 1 week of antibiotic, it wasn't working. So I came back home. I just took one tablet of steroid. This breathing started. I got terribly scared. I said, like, no, I'm not, no way I'm touching. And then I called the doctor and I said, I'm very, very sorry. I cannot take the steroid again. So when that happened, the next day, doctor said, ma'am, I am really not able to understand why you are not for this very reason, we give the steroid and you are so, it is working ulta for you. So, these are some of the experiences. And then immediately he stopped the steroid, and for that ear infection, basically. So I was sharing my experience with him, and he told that, ma'am, I understand, then I think I should also start following it for my patients, whatever you say. And D3 nebulization, I was telling him, he was not, what is D3 nebulization? So many things I explained to him that day. So like that, I can tell many testimonies in my own family, in my own life. And with my husband also. After we started this intermittent fasting, his grade 2 fatty liver became grade 1, and a healthy lifestyle at home. And it's been more than 4 or 5 years that we, by the grace of God, we never hit a hospital. And in my family, our parents, my mom, she had this spondylitis issue, knee pain, so many other issues she had, and continuously giving this supplements, and how her health has improved tremendously. At this age of 66, 67 years, she is the one who does all the household work. She doesn't have a maid at home. All the household work she does. She's, she drives on her own to the church, everywhere, wherever she wants. She drives for um, wherever she wants. She drives for to go for shopping or anything. So all the work, all in all, at this age, like any youth, how they would run for the work, she is running. And with her diet changes and high protein intake, in this age, people will say, na, she used to have uric acid, and I used to ask doctor, and the doctor says, for her uric acid increase, doctor said, no, you should not eat more protein, so you should avoid protein. So she was more on carb diet. And then after that, when I just clarified with Dr. Bano, he said uric acid is all because of high intake of carbohydrates and fruits. So immediately we cut down all on her, and she is also on a low carb diet. She does not eat carbs so much every day at this age, and every day she is eating plenty of eggs. She at least 4 eggs she eats, and per day compulsory she is having non-veg at home. She has non-veg at home, lunch or dinner. No, not lunch. She is also on intermittent fasting at this age. Like, she just has 2 meals, and she is also reducing her weight. She has also, slowly reducing her weight, and she's more energetic, and she's able to do. And from that day onwards, our journey in this has started. And now, by the grace of God, I'm able to help many church members. In our church also, a kid is autistic, and that autistic kid, that mother tried everywhere, Ayurveda, Siddha, allopathy, everything she tried, but nothing worked out. And I was telling her during the time of COVID itself, I was telling her when she was in her hometown, but she wasn't listening. She was from a pharma background, so she has 1,000 questions in her mind. Though I explained many things, she wasn't able to listen. But after some time, she tried everything and nothing worked out, and she came back. She mainly shifted to Hyderabad for this reason, to get her treated. That's the only reason they shifted to Hyderabad again. And again, she connected with me, and now the child is doing amazingly well. The child has begun to speak now. It's now almost a year. Tremendous improvement with the kid. And we see that child, how she is behaving now, and how she has become much smarter. She has been admitted in a school now, and her sleep pattern has improved. Her vocals have, this just in the last 1 month, she started repeating everything what we are saying. She's beginning to repeat clearly the
Yeah,
sentence she's repeating. Yeah. So like that. Yeah, sorry. Should I stop?
yeah, 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 yeah. I mean, I know this is in a long journey.
Yes.
But at least for the sake of all, right? I mean,
Sure,
just
sure.
one or
Understood. Yeah.
two things are, yeah, good.
Okay, fine. Fine,
Hope you
fine.
can, yeah, you can come to conclusion. Yeah, sister.
Okay,
Yeah,
yeah, sure. Thank you, brother. Yeah, so like that, the kid, the kid has, so much improved. Like that, many people in our church also, and now by God's grace, I am guiding many people also. We have seen many recoveries from rheumatoid arthritis. My mother also had this arthritis, so she does not have any pain with this IR lamp and all those things. She does not have any pain right now. Like that, many other I'm guiding now. Yeah, so I really, really thank God, and thank Dr. Banu for all the selfless effort that he is putting to help and guide. Thank you. Thank you.
yeah. Thank you, sister. Sorry for interrupting, but it was really, Sister Revati Bose had, lot of, experience, and she got benefited uh, for herself and the family members. And also, They were guiding very critical cases also, even in their church members. So yeah, I know. I mean, this throughout this journey, there are so many people have so many testimonies. But for the sake of time, those who are sharing also just restricted to one particular specific area and what is the problem and what you have tried and how you got the healing or recovery, um, and how you have followed this guidance, like what are the supplements and what are the diet change and what are the lifestyle changes, exercise and all. So how you have changed and how you got benefited from this. So if you can share those pointers, then that will be great. So, and I believe now it's 7 o'clock. I'll just, briefly tell few words in this, through almost like, 3 years of this journey. We have seen people, especially when we started these health sessions. Initially, we thought of like, let it be beneficial for those who are suffering with infertility, those who are waiting for the children. So that is the reason that we started. But that time, Dr. Banagar told like this is not for specific to infertility. These sessions are for everyone. So this is a health sessions that everyone can follow. So that is how it was initiated. So that time, I think only 100 to 150 people have joined. But as the journey progressed and as these sessions were recorded and slowly one after the other they started following these sessions, then now we could see almost like 100 plus 110 or 120 couples got conceived, and some are like exceptional testimonies like 12 years after their marriage and 13 years, 14 years that they have waited for the children, and now they got conceived and they had babies in their hands. So what a joy it is. They have tried so many options for the children, but as they started correcting their vitamins and minerals, their health state, then slowly they themselves become very healthy, and in the process they also got this benefit for what they are waiting for. And we have seen some, one boy called Lakshman. He suffered with cancer at fourth stage, and he also got recovered. And now he's going to the school. And they thought like, we don't know how long he's going to survive. But now that boy is very active and going to the school. And we have witnessed, and some with breast cancer, she also got recovered. I mean, in the days to come, we will listen these testimonies. I'm just giving a very brief what we have seen: foot ulcers, psoriasis, rheumatoid arthritis, and people have suffering with the asthma and autism. Especially, we have um, many families, children, those who are suffering with autism. They also seeing a lot of change in their kids. So what we are trying to say is, in this journey, we have seen so much of people. It's not specific to sickness or what kind of disease or what kind of problem, but it is about, when you correct your health and everything will come on its place in its journey. The basement is, it is on the design of God. It is based on God's design, because God who created us and our creation, I mean, how we were created, it's a robust design. And body has a capability of recover on its own if you give support system, right? So that is what the platform and all these health sessions are based at, and that is where Bhanugaru is guiding us and educating us throughout all these sessions, the one point he stresses is God's design is our foundation. That is where we are building all these, health sessions, right? So, with that, I think I hand over this time to Dr. Vanagaru, and he will share um, uh, first topic, health topic today. And yeah, over to you, Vanagaru.
Okay, thank you, Prakash, and good morning once again, everyone. And when I spoke previously about an hour ago, many of you haven't joined, and welcome to everyone, all 425 of you. And so it's so exciting to be able to speak to you this morning regarding sessions that regarding topics that concern all of us, especially nowadays, that we are dealing with many issues with severe disease. Whether it is a multi-organ involvement or the cancers that are spreading like wildfire. So I think today's topic, I just wanted to alert everyone, but this is not designed um, to scare you or to frighten you. But the thing is, we just want to explore some of the things that are surrounding the illness that is being that people are coming down with in the recent times. All right. Let me see just a moment. Yeah. So the more and more we see, and people are becoming, the sickness that is being presented to all of us, and in our families as well as in our friends' families, in our churches, in our society, and in our people that are acquainted to us. The disease is the disease progression has taken a totally a new character, if you will. So let's explore some of the reasons why it is so. Hmm? And also there is there is an I think incidence of the autoimmunity uh, beyond anything that has happened historically ever since COVID. Okay, so prior to COVID times, autoimmunity, yes, autoimmune diseases were part of life, and people were coming down with autoimmune disorders like rheumatoid arthritis or um, various other lupus or very eczemas or psoriasis and all those things. But now we see them at a totally different level, and I think more and more, autoimmune disorders are being manifested. Myositis has we have not heard about myositis prior to COVID, but several prominent figures in the movie industry and in the media, and several of them came down with this myositis, which is a very rare autoimmune disorder. And so suddenly, post-COVID and post-COVID vaccines, I think all these autoimmune disorders have become commonplace. And also, another feature that we can see is the malignancies that are resulting um, are for instance cancers, various cancers. Even before they're found out, they are progressing to stage 4, and also and then even before the treatment can be started, or even just right after the treatment is started, there is a I think um, the quickly that those malignancies were progressing to fatalities. So what is the reason for all this? Okay, so if we look at the pathophysiology of cancer, and to a large extent, this cancer is an immune system dysfunction or immune system disorder, where immune system is not functioning as it is supposed to. And also cancer is a metabolic disorder because metabolism is largely deals with the energy dynamics of our body and the cells, the energy production and energy utilization. All these pathways are involved in the metabolic processes, and cancer is one of the one of the, is a disease which is characterized by this metabolic dysfunction, where the energy production mechanisms have gotten compromised and the energy utilization mechanisms are compromised, and that is what cancer is. So, cancer and also even the cancer cells require a lot of energy to survive and for them to grow. So, that energy is derived through alternate mechanisms. See, in our somatic cells, like general regular cells in our body, they derive energy from a process called oxidative phosphorylation. Okay, so there are organelles in each of our cells, and these are called mitochondria, and each of our cells can have multiple mitochondria, up to 100,000 or 200,000 mitochondria in each cell, the purpose of which is to generate energy that can be used by our body for our metabolic needs. So the problem is, this mitochondria, when it is compromised and when it is not functioning the way it is supposed to, and that is the main. The cancer cells are characterized by mitochondria that are dysfunctional. Okay, so cancer is a disease that is characterized by compromised immunity, as well as compromised metabolism. So in all this, the way we clinicians look at these things is, the way the researchers have been looking at for the past, clinicians have been looking at the cancer for the past few decades, is, cancer is something like, it is um, coming in, and it is, it's an enemy that is coming into our body and establishing itself, and our most of our efforts. Okay, please unmute. Please mute yourself. Okay, if
No, I changed that as
okay.
Okay.
All right. So, see, first of all, if you unmute and you start talking, that breaks my train of thought, and I know it's very difficult to get back into it once again. So, cancer is kind of, I don't even know where I was at this point. So, please, just do not disturb the session. Okay. So generally, the way we the we traditionally look at cancer is, cancer either has to be cut out of our body, or is or burned out of our body, or is bombarded with this chemical concoctions, so that we can kill the cancer. But the problem is, the circumstances that resulted this cancer being present in our body are still present in our body. And the thing is, even if we are able to get rid of this tumor, which is just a mere manifestation or mere symptom of underlying disease process or underlying dysfunction that is still there. And even if we are able to eliminate this tumor by any means possible, by surgery or radiation or chemo, and unless we address the underlying disease process or underlying deficiency or underlying dysfunction, and that cancer will show up again. And that is what we see as recurrent malignancies. And when a cancer returns, and it is very, the likelihood of that person's survival goes down um, by a lot, by an order of magnitude or even higher than that. Okay, so now the reason why I chose this topic today is, there is something called this, for in our immune system, there is this cellular immunity and humoral immunity. And in humoral immunity, this is characterized by these antibodies that are generated by the plasma cells, right? So these immune cells and these antibodies, they can fight against the cancer cells as well. But there is a certain class of antibodies called IgG4, immunoglobulin G4. Okay, this class of antibodies, there is a specific manifestation of these antibodies, which is very noteworthy in this for this current discussion. So if you look at these IgG4 antibodies, okay, these, if you look at the cancer patients, and if you look at terminal cancer patients, or if you look at late stage cancer patients, IgG4 expression is much higher in these cancer patients than the regular healthy individuals. So, as far as back as 20, 30 plus years ago, we know that IgG4 played an important role in how cancer progresses, yeah, or in the progression of cancer. Okay, so now we come to a point where we see the cancers progressing to even that cancer diagnosis to the fatality, for the person dying for mortality, is taking a lot less time nowadays than before. Okay, and science and the researchers have taken notice of this, and this IgG4 concentration, is correlated with this cancer progression, because IgG4 antibodies will cause they are involved in the evasion of IgG4 antibodies are involved in the evasive maneuvers that cancer requires to survive. So I think we have heard this immune escape. So somehow, IgG4 mechanisms are not completely thoroughly understood at the moment, but it is still, it is of, it is noteworthy that, that IgG4 somehow, this overexpression of IgG4, somehow helps the cancer to evade other immune mechanisms that will prevent it growing as quickly. Okay, so that's what we need to understand here. I think this talk is a little bit more technical, but what I want you to understand is IgG4 plays an important role in the survival of the cancer in our body. And also there is something called IgG4 related disease, which involves not only this cancers, but it involves multiple organs, and it involves lungs, liver, pancreas, and spleen, and kidneys, and brain, and heart, and all these organs are involved in this IgG4 related disease. So why am I talking about IgG4? Okay, let's go back and look at the vaccines, and especially the uh, the COVID vaccines. Okay, which are mRNA vaccines, and not only mRNA vaccines, but the other types of vaccines that are available in India as well. Okay, there are many researchers who are concentrating on these vaccines, and how these vaccines relate with IgG4 expression. It is beyond, it is now, it is not a speculation, but it has been proven. I think the scientific community is in agreement that the post vaccination IgG4 expression is higher in vaccinated individuals, and so much so that it is, I think it is causing IgG4 related disease. So the IgG4 related disease has gone up in incidence post-COVID vaccination. So, do you hear this? Do you hear what I'm saying? So, the IgG4 expression. See, the thing is, the repeated stimulation of our immune system by these antigens. What is an antigen? Antigen. Okay, so we will talk about this paper in just a moment. Okay, and so IgG4 related ophthalmic disease, and no, that's okay. Leave it on, Prakash. Leave it up there. Okay, IgG4 related ophthalmic disease. I mentioned every organ system that is that is affected by this overexpression of IgG4. So IgG4 related disease is extremely rare prior to 2019, but post 2020, this IgG4 related disease has taken a new significance, that it is its expression has it is in its incidence has gone up by a lot. Yes, and yeah, nephrotic syndrome also. So the thing is, is related to the topic that I'm discussing right now. So, these vaccines, those started with a good intention of preventing COVID and preventing COVID-related fatalities. But it is the unforeseen consequence of this is it is upregulating this IgG4 expression. Why is that so? Because if you look at traditional vaccines, how those vaccines function is, the this inactivated antigen means some part of the virus, or some part of the bacteria, or some part of the thing that we are dealing with, that antigen is introduced into our body, and our immune system recognizes that, because there are pathogen associated molecular patterns and PAMP and other mechanisms that are in our body, these dendritic cells and all these things, they come together and they recognize this pathogen, and they generate this antibody response to that pathogen. See, the thing is, if that is the case, the pathogen, the antigen that is introduced into our body is very limited, and our immune system is not stimulated repeatedly. But what happened with COVID vaccines is, the antigen is being generated by our own body. So the main feature of these COVID vaccines is, these COVID vaccines are crafted in such a manner that our own body generates these antigens repeatedly, because these viral signatures and the spike proteins are being generated by our own body, our own cells, and also to those cells, our body itself is generating antibodies. So in this context, okay, so body is thrown into a point where this IgG4 expression has gone up by as overexpression has gone up post COVID vaccination. So if you look at IgG4 related disease, and which is not it's not a simple disease. It is an extremely significant disease that we cannot ignore, because every organ system can be involved with this. And also there is the what is it there is something called autoimmune pancreatitis, and that incidence also has gone up post COVID vaccination. Okay, and so the thing is, this is the paper. Go to the title, Prakash. Go to the title. It says IgG4 antibodies induced by repeated vaccination may generate immune tolerance. See, we the if the vaccine is working properly, it will not generate immune tolerance. But what is happening here is IgG4 antibodies induced by repeated vaccination and repeated stimulation of our immune system by the antigens that are being generated by our own body is causing immune tolerance. to a point where this, our immune system is not able to deal with, and the COVID that is resulting in, in these particular individuals is much more severe than it would have been otherwise. Okay, so I don't want to go into all these extensive details, but I just want you to notice the the problem that we are facing right now. So IgG4 related disease can cause all kinds of issues with all it can cause problems with multiple organs in our body. And let's go to that the, that paper where ophthalmic disease, Prakash, go back. Okay, so okay, so go back to this immune evasion. Let's go to immune evasion. Okay, there are papers published in the recent times in 2020, an immune evasion mechanism with IgG4 playing an essential role in cancer and implication for immunotherapy. So this is not, the thing that I'm talking about, this IgG4 overexpression and IgG4 related disease is not, it's not, we are not imagining about this, but it is a reality, scientific reality, and that we cannot ignore. Okay, let's go to that ophthalmic disease, please. Okay, so this is a case reported in 2020. Okay, go back in 2024 February this year in Japan, where a young woman was vaccinated, and post-vaccine she developed this ophthalmic disease, the eye problem, right after being vaccinated. Okay, and this paper talks about, in detail about that case presentation, and how the researchers have come to the conclusion that it is because of the COVID vaccination. Okay? And also there are many cases that we are coming across even in India and even here of multiple issues with severe renal insufficiency, severe heart disease, and severe neurological problems, and even eye problems. Okay, so these are all. I think if we look at the IgG4 levels in those patients, I think the IgG4 levels will be probably be very high. And also, this IgG4 can inhibit immune responses that normally fight cancer, and such as antibody-dependent cellular cytotoxicity. See, the thing is, this antibody-dependent cellular cytotoxicity is also its immune system is the what is coming between you and the cancer is our own immune system. And the thing is, this IgG4 can inhibit such responses, which are protective against such cancers. And also IgG4 related disease can cause neurological manifestations, and also and so IgG4 related disease is defined, it can be defined as it's a multi-system inflammatory disorder that can affect many organs. Okay. And also another thing I think we talked about in our sessions, we talked about extensively about the vagus nerve and its importance in our not only in our digestive system and in our how our pancreas functions, and how our digestive system functions, and how almost it's your vagus nerve is extremely important nerve in how that determines how our digestive system functions. Okay, so and IgG4, and also this related complications can affect this vagus nerve also, which controls the functions like digestion, heart rate, and mood, and our immune response. And a vagus nerve is also it's a it's a and how our gastrointestinal tract communicates with the brain. So, what we want to say here is, even the scientific in the medicine, they the doctors recognize that IgG4 related complications. To prevent those, I think early on we need to see if IgG4 elevation has occurred, and how we can mitigate the complications related to this IgG4 overexpression. So I just want to since I mentioned this vagus nerve, okay, the one thing that we talk about this to mitigate or to alleviate vagus nerve dysfunction is vitamin B1. Okay, so vitamin B1 plays an extremely important role in how our body maintains its vagal tone. And also we talk about the various supplements to correct vitamin B1 deficiency. And also for nervous system disorders, we have we talk about alpha lipoic acid as well. And also we talk about this uh, the NAC, N-acetylcysteine, or mucinac, the acetylcysteine, correct? So acetylcysteine also plays an important role in downregulating this IgG4 expression. Okay, so thing is, what I'm saying is the nutrition is extremely important in how we can we can what is it mitigate the damage from this IgG4 related in IgG4 related disease. So we just cannot just sit and wait. And also vitamin D is important in I just cannot simply overstate the importance of vitamin D. Vitamin D itself is, it downregulates this IgG4 expression, and also vitamin D upregulates the antibodies which fight against various diseases, including cancer. So vitamin D plays an extremely important role in how our immune system functions, and vitamin B1, okay, is protective, of our nervous system, and also vitamin B1 plays an important role in how our energy is produced and how energy is utilized, and energy is produced by our mitochondria. And so I talked about that vitamin B1 in a separate session, and we will talk about it here. And that session was in Telugu, but we will address these nutrients individually in the days to come. So vitamin B1 is important, vitamin D is important, and vitamin K2 is important. And all these things are related to IgG for overexpression. And also N-acetylcysteine, the mucinac, is extremely important in downregulating this IgG4. So all these complications that can result from this IgG4 overexpression can be addressed by these supplements that I have just mentioned. So, who says the nutrition is not important? And who says the nutrition is not does not play a role in how the damage that we to that is a result of all these the things that we are putting ourselves through. So, in conclusion, what I would like to say is, I think there is a lot more that is going on, dear ones, in the for the past 4 or 5 years, and it behooves us that we understand what we are dealing with. And when we do know that, when we understand that, I think we can, this why there are so many outdated there is so much outdated information about these vitamins and the nutrients and nutrition that is so prevalent in our current society. It is affecting each one of us, even to this day, because many of us are conditioned to think that vitamin D is a necessary evil, and we avoid it until we cannot avoid it anymore. Please, let's not do that. And also, let's try to understand how these nutrients play an important role in maintaining our the robustness of our health. And we, the goal of this platform is, we believe in God's design, and we believe that God's design is perfect, and it is robust, and it is kind, and it is awesome, and it is full of wisdom. And when God designed our body is bestowed with a wonderful ability to heal itself, provided we provide it proper nutrition. We give it proper nutrition. And proper nutrition, does not just mean that we just search Google and eat whatever is healthy. No, I think it goes beyond that. I think we need to understand fundamentally how all these nutrients affect our body, and how they help our body, and how the lack of it is will affect our bodies, and the various diseases that we are dealing with in this modern world. And it is your responsibility, because your health, and your family's health, and your loved one's health is God placed it in your hand, and it is your responsibility to know all these things. And we are here to give you that information. And whatever we know, and whatever I have learned, and it is, and we are giving that information to you through this platform. And I hope this information is helpful to you. And thank you so much, and thank you for listening. God bless you. Prakash, over to you.
Yeah, thank you. Thank you, Dr. Now we have a time for question out. So first preference is ask the questions related to this particular topic, and after that,
Your voice is
Prakash, your
low.
voice is very low, Prakash.
oh, yeah. So now we have a question out time. So ask the questions related to specific to this particular topic. Okay. So general questions, apart from Saturday and Tuesday, you will have rest of the days. We'll have a separate question hour time. So that time you can ask general questions or a specific health related questions.